I have had experience on the USA system, as my husband lives down there. I am separated, but he lives there, and so I've had first-hand knowledge of their system. Now, you have to pay a lot of money down there to be in the system. And him, even though he is a senior citizen and he's retired, he has to pay something between $200 and $300 a month to just have basic health care coverage. And I'm not including anything over and above that. There's no such thing as dental or anything in that system that will allow him to have that. And also the medications, if you have to have medications down there, it costs a lot of money. Now, I don't want to see that happen up here. And that is, you know, with this government, the way they're doing things, I'm a little afraid that they're kind of pushing that way.
Well, on the question of sustainability, the Canadian Centre for Policy Alternatives has put out statistics, have gone over the government reports and the so-called budget, the Consolidated Revenue Fund, they call it, which is not really the budget. It's a small basket of public services and that. But they're, and in fact, based on the government statistics, since 1984 to 2006, Medicare has gone up 1%. Not 43% in a year or two, but 1% over 18 years. And so it gets back to the old story. You prove what you want by providing the figures that you need. And, of course, panicked everyone with the costs are just going completely out of line. They're not going out of line. For example, with seniors, they point out that the increased cost in seniors is less than 1% since 1995 to 2005. Less than 1% increase based on seniors' costs. So, they're, you know, figures don't lie, but liars figure.
Yes, and the process that they're going through with these public-private partnerships is costing a tremendous amount of money. And the CEOs that he hired recommended that they not use the public-private partnership to build the hospital in Surrey because it was costing so much more and it's inefficient. Like they said, you can't make changes. Like when you're building and you realize that something needs to change, it's a tremendous process and a costly process. And also all of the legal fees building up to these public-private partnerships. That's what we pay. We pay that, not the corporations who get the contract. So I agree with you, Bill. It's ideological. It's not because of money, because they're wasting our health care dollars right now in all of this process.
On the whole, I think it's a good thing because any government that consults its people is a responsible government, and this is what the BC government is doing here. The only problem I see is if they don't listen to the people, if they don't implement what the people say, then they are going to have a lot of problems. But the mere fact that they decided to consult the people is a good thing. And talking about sustainability, I suspect there is a need or a desire to commercialize public health, which is dangerous because if you look at the business, if you want to use public health as a business enterprise, then you are going to run into trouble. It should not be run as a business, because the essence of business is to make a profit, to make more money. Here you are providing a service to the public. You don't have to think about profits all the time.
Some of the facilitators in the conversation, not all of them, but some of them were rather reluctant to make note of suggestions where public health care support was mentioned. If the odd person did mention a private system, their comments were written down immediately, But someone who, on the other hand, mentioned public, well, it might take 2 or 3 attempts to get some of these facilitators to make a note of this. So they weren't always accurately reflecting the group's opinions in that regard.
Many people feel that so far the government hasn't been listening, and that this, the conversation is a conversation, but it might necessarily be more between the citizens. But would you say, is the government listening?
Well, I think all you have to do is take a look at the kind of engagement we've pursued with the website. If it was a case where we were going to do a dog and pony show and have just a nice little happy feeling that people were able to talk, I don't think we'd be going to the lengths that we are to put out the information that people are providing to us. Certainly, the conversations wouldn't have the attention of the minister and the parliamentary secretary, myself, and the premier at this time. So, again, I understand it, because I think, I completely understand the skepticism of government when it comes to that, and it feels like cold comfort to say to them, well, you're going to have to see how the process rolls out. But I suppose I would commend them to taking a look at how the process has already been, and that everything has been above board and open and really accessible to people so that they can go themselves and see what's going on.
And what would you say about then the response that I got when I was talking with people, is that, yeah, we're having the conversation, and in the context of the conversation on health, there is listening, or the process is occurring, but when you look outside of the context of the conversation, there's the private hospital that just opened, there's more certain private clinics, and there's more private things opening. So what would your response be to that?
I guess it's another challenge we face, which is perceptions, because we've had fewer private clinics open since the BC Liberals have been in office than we did in the 10 years prior. That was when the big expansion took place. So part of that comes down to what people, again, define as private. I think you have to recognize that in a system as complex as healthcare, that you're not going to put it on hold for 18 months while you talk to people. Things are going to change. Things are going to evolve. We have laws in Canada that provide for a framework in which people can operate. And if those facilities are operating legally in Canada, it's not up to government to stop them. It's up to government to ensure that they're abiding by those laws. And that's been done in the case of the clinic that opened, and then the minister reviewed their pay issues and found out that they were acting in contravention, ordered them to change, and they did. Those things are always going to continue. You can't stop the system. But that's part of the reason for the conversation on health, is that we've got a lot of ad hoc developments taking place in healthcare without a lot of thinking ahead to the next 20 or 30 years. And that's the shift we have to make. 20, 30 years from now, what do we want it to look like? For those who decry any private involvement at all, if we consider the role of doctors' offices or labs, then we have to ask, well, could the system survive without any private interest?